Okay, good afternoon, everyone. My name is Jen in the STI Training Department, and today we're covering the ICD-10 diagnosis transition for both practice manager and clinical. If you only use our practice manager software, then the first 25 minutes or so will be focused on practice manager, and then you simply could drop off the call. If you don't use our EMR, the rest of the training would be under ChartMaker Clinical. During our talk today, I do have to mute all phones as a courtesy, and I will open them at the end for questions and answers. If you don't have a mic or you prefer to type, you may use the WebEx chat feature at the top of your screen to send me your questions, and I'll review those at the end. So October 1st, 2015 is the start date for billing ICD-10 codes. And certainly we're hoping your office has a plan of attack ready for this transition. To help, we've been sending our ICD-10 newsletters to spell out the steps that would work to split up this huge transition into smaller bites, such as ordering your code books, updating a charge slip, scheduling your ICD-10 training for providers. Please don't hesitate, though, to email me a request if you have not been receiving those email newsletters, or if you simply need to change the email address of the staff who receives them. I did attach to my email the links to those 3 that we have published this year. Your first main step is to assign a project manager, or at least a key person, to keep track of organizing this whole process. That will help everyone keep on target. I can confirm for you that all 68,000 plus ICD-10 codes, as well as 23,000 category headers, are already loaded in our ChartMaker 2015 version. You will not be adding any codes yourself. Also, for the foreseeable future, STI will update and maintain that ICD-10 code listing for you. So next, you will find that much of your training is going to happen outside of STI for actual coding training. There are many good resources on the web for learning about the ICD-10 codes and understanding them. This web page that I did list on our agenda, the roadto10.org, is Medicare's dedicated page for ICD-10 education. They do have webcasts. If you click the webcast, that is several video series that take you on the road to your education for ICD-10. And also in the center, they have specialty references. So if you happen to be, one of these specialties, or if you're not, the last option also works. They give you some examples of situations with patients and how your notes may change. So those are types of things that I can't show you how to change, of course. But providers' notes, much more detailed documentation may be necessary if you have not already been writing whether drugs induced an issue or underlying conditions that were factors, exact body parts, and some codes even have what number encounter included. So it's something to be aware of and to educate yourself about. What I will be showing you today is how to prepare your own software and jumpstart this coding of ICD-10 and possible dual coding of your patients for a smooth transition. So let's begin. We'll start here in Practice Manager. We have a global date setting for the October 1st Readiness Day, which is telling the computer which code set to send, depending on your date of service. This is already preset for you, but you can check it on your own computer by going to Add-ins, Insurance Billing, Other Configurations, and Configure ICD-10 Readiness Date. This is already preset again, but just in case you do find that an insurance is not yet ready for ICD-10, this will be the place that you will put in either your insurance code or their payer ID at the top so that the computer knows what date they are ready for ICD-10. So here I have an example of how a workers' comp insurance might be entered if they were not ready until next year. So do not enter anyone here until you do have verification that the insurance is not yet ready. And simply hit OK at the bottom. So the next step in your plan may be to get familiar with those new codes. So you'll start by running a report of the existing codes you already use. So here under your financial subtab of reports, diagnosis, analysis, detail, I would suggest you highlight the select criteria, select the charge month end date, and change that to be charge end date, and then greater than or equal to, and maybe write your January 1st of this year. You don't want to go backwards into 2014, only because some of those codes may have been retired. Click the Update button, and that will push it up to the top, and now you can simply preview or print your list. This will give you the list of all the codes you have used since that time frame. The last column will give you the total number of times you've used it. If, in fact, the report you get is more than 5 pages long, you may want to export this report into Excel and sort it by that last column so that you can focus on the most used codes. Certainly you wouldn't want to sit through 12 pages of codes that certainly you will use at some point, but that shouldn't be your first focus. You want to really focus on your most used codes. To export a report, you can take this little envelope icon at the very top. For the format, you'll choose the very last option for Excel. In this case, it's Excel 8 Extended. Disk file will let you save it on your computer, which you may need to do to email to yourself at home if you don't have Excel at home, at work. And simply hit the OK. There's one more little option to select. For Excel, you always want to highlight the last option, the tabular format. That keeps everything in the same row and column as you would expect. And then simply hit OK. It will ask you where to save that, and then you can go forward in resorting this list if you need to. Okay. So there are several options of what you can do for this list now that you have your most used codes. In both Practice Manager and Clinical, we have a search tool that would allow you to find the best matched ICD-10 code or group of codes using a Crosswalk tab. You may simply open that, which I'll show you, create your new list of what will be your most used ICD-10 codes. The other option is if you already are writing your chart notes in Clinical, you may want to do that step directly in the template editing screen so that you can quickly add a new list of codes to your provider's notes for later. And then possibly to start with a shorter list, you may want to focus only on your chronic codes and work on those first. So I'm going to close this, and I'll take you to that search. That search is up here in Administration, Diagnosis Search. It allows you to look for those crosswalked ICD-10 codes without having to be in a patient chart. You do not have to use this, but it is a nice feature if you are simply making yourself a list. Also, just to mention, there are published specialty crosswalk cards that you can purchase. The link to one of those vendors was on our newsletter. Those specialty crosswalk cards would list the main codes your specialty uses, although it won't be inclusive of all your full list, but certainly would be convenient for a provider maybe to have a copy of that in each exam room to use with the basic charge slip. It is something to think about. A charge slip currently that you use, if you do so, may have 100 or 150 codes, but once you convert those to ICD-10, you could have 800 codes, and that's not something you want to be printing for every single patient, and nor would you need to. So let's walk through this diagnosis. Administration, Diagnosis Search, and then I'm going to maximize this screen and click Crosswalk tab. What you'll do here is at the top, you'll be typing in the first code on your list, and I'm going to use a heartburn code as an example. So this code has what we call a one-to-one match, which means it's an easy one. This is the code you used to use. R12 is the code you'll use in the future for ICD-10. How you can read this, in the center, there would be items before and after that may relate to this code. In this particular case of heartburn, there's no other specific codes with the word heartburn description, so you truly only are using heartburn. Something to mention, though, your third column is giving you some exclusions to notate. So this would allow you to have two other codes that may make sense for your patient instead of the R12. So if you're writing down yourself a little list, you'd be writing your R12, plus you might write your R10.13 and your K30 with those different descriptions. So then we'll go again to your next code. So at the very top, I'll try a headache code. So this now is a whole new ballgame. There are multiple options, and even in separate areas of the code book. So to check out specifics, you highlight the first, and then in the center, you're reading the descriptions and finding what else may be necessary for your provider to have as a list, in a list to use. So in this case, it's sending me to the G44.1, so that may be the best crosswalked code for my old headache code. But if you notice, there are many, many other headache codes. So I may need to open up these categories and then look for items that I would use for any type of my patients with headaches. So how to read this center? Any number or code set here with a plus or a minus next to it is actually a category. It's not a billable code. So this G44.2 is not a billable code. If I open that up, it shows me 3 more categories underneath. So to get a real billable code, I'd have to open up each of those categories. And then I see there are 2 specific tension type headaches. And if I open up this item, there are 2 of these. And then the last. So under tension type headache, I do have 6 billable codes with very specific descriptions. So this is also something that you want to have providers be aware of, because in their note for their exam or their in their note, they need to be very specific for you so that a biller can code that. Now, if the provider's in the EMR, they have this right in front of them, and they'll be able to code it properly. But if the provider is not coding, it is something they must be aware of so that a coder can have that information. On the right side, you also would be trying to keep aware of what any exclusions may be noted on the right. And then you're coming back to the left side, highlighting the next code that came up as a crosswalk code. And in this case, it's a simple R51. So that's another code that you would write down for yourself. This is in the R, General Symptoms and Signs area of the code book. And then you would repeat again with your next list, code on your list. So we'll close this and go to a real patient chart. Okay. So in the patient demographic screen of Practice Manager, you have the option to use codes here of chronic diagnoses that your patient is seen for on a regular basis. You may not use codes in here at all, and that's perfectly fine. In fact, an office who uses the EMR and is coding all in the EMR would not need to use this screen at all. So please don't think I am advising you to use this screen. It is something that is helpful for an office who only use our billing software. So chronic codes such as your diabetes and varicose veins and allergies, those may be items that you're putting here. So we've expanded the view so that you can see both sets of codes if you do intend to save both sets here. we have a convenient crosswalk shortcut. The way to use the crosswalk is to double-click on an existing code. So I have this diabetes code. I can double-click that code. It takes me directly to the crosswalk. I can maximize the screen if I need to. When you're first starting looking at these codes, you do want to have the full screen so you can read the long descriptions in the center. It automatically highlights my diabetic E11.9. And then in the center, I do want to get familiar with these type 2 diabetic codes so that I can make the best decision for each patient. If it is this E11.9, I simply double-click that, and it'll pop it down for me. And when I hit OK, it puts it on my patient demographic screen for me. I can do the same thing with the next one. Double-click, and it will show me, if I maximize this. Once you know these codes, you won't have to keep maximizing. And it will show me what that code is and maybe some others. If I needed to add more than one, I can add as many as I need to as I'm sitting here. Also, if you add one you didn't mean to add, you can highlight that and remove. And then I'll hit OK. Right now, before October, it is a nice idea if you already use codes here to get your staff have some practice looking up those chronic codes. This is the perfect place to do it. Open your patient screens of patients who will be coming back in October or later, and double-click to find that ICD-10. You can save both sets of codes. The system knows that it's not going to bill out the ICD-10 until the date of service of October 1st. So it is a nice way to practice. You don't have to use this screen at all, but it is available to you. If you're already using codes here, then it might be a good idea to go through some patients and save those codes. Okay, so let's go to your chart screen, and we'll bring up that same patient. You can do the same thing on the chart screen if you bring over the codes from the patient tab, or if you use your L button for show me the last codes that I used on the last charge for this patient, that can bring that over. As you see here, it's only showing me the ICD-9 and not a split page. That's how you'll see yours right now. It's not split until you use an ICD-10. So once you start using ICD-10, even just as a test, then it will split that screen for you. But at the moment, if you went to your chart screen, you would see this. So on this chart screen, the crosswalk is the same, easy to use. Double-click on your existing code. It takes you directly to this area where it lets me see all those codes. I can hide, instead of maximizing if you like, once you're aware of the exclusions on the right side, you can take the blue arrow and close that little third column so that you can see more of the descriptions in the center. So that's another option instead of minimizing. Then I can double-click that and hit OK, and I pop it on the screen. Right now, in August, you don't have to do this, but it is possible for you to, just to get some practice. So it might be something that you want your staff to start looking at, start adding to a couple patients here and there, just so that they get some practice. The more you look at these codes, the more familiar they will feel to you, and October 1st won't be the first time you're touching an ICD-10 code. So it's really a great idea to start doing this now on a couple patients here and there. You don't need every single patient, but it certainly would be a good practice. So again, your quick crosswalk is to double-click an existing ICD-9, and then you can close out that last. And then simply double-click on the one that you needed. You're always looking above and below in case there are more descriptions. Even though you get a crosswalk exact code, that may be the best match for the code, but because ICD-10 is new, you do want to look around above and below just to see if there are more specific that you can be using. Okay, so let me show you now how to search from scratch if you didn't have any codes here or if you just need a new code. You can search by name, so you simply can start typing a word or 2 words and hit the little glasses for searching, or use the F3 key. So F3 will search by description. So I can come here and double-click that. That will give me my ICD-9, which I need to build today. If I want to look at the crosswalk, as long as I'm highlighted or highlit on this lack of sleep, I can hit the crosswalk, and it automatically takes that V code, pops it in the top, and gives me the crosswalked sleep deprivation. So that's also a nice, easy way to go from an ICD-9 to the crosswalked ICD-10. And then, of course, if it's a new code that you're looking at, make sure you check out the exclusions on the right side. But then you can hide those and find the code that you would like. And then hit OK. Okay. The other way to search is if you know the beginning of the code, but you don't know maybe the last 2 digits. You can start typing a code there and hit the F4 key. F4 is a description of the ICD-9 code, and F4 will go to ICD-9 now. In the future, after October, F4 will go to ICD-10. So you would have to be typing in the E11 something or Z91 something. So here I can choose the code that I need. And if I'd also like to see the crosswalk, I can simply click Crosswalk tab, and it will take me to this exact R10.12. And that code was already a specific code, so there isn't anything else to look for. But you do always just want to be aware of what's going on. There are still some unspecified codes for ICD-10. Medicare a couple weeks ago did release a letter that said they will still pay on unspecified ICD-10 codes, such as this one, for a full year until providers get more comfortable with using these new code sets. So it is still possible that you might be using an unspecified code. But if you do have the chart in front of you and the provider is writing detailed notes, then you would be able to. And maybe at the time you don't have more information, but the provider didn't. You could be using this code as well. But once you have that specific information, you'll be able to use the correct code, the most specific code. Okay. So on this screen, we also have made some changes that you can move around the diagnoses so that you can be billing the most acute or the most important code should be number 1, and then your other codes would be 2 or 3, depending. At the moment right now for the summer, it's not important for your ICD-10 to be in the right order because the system will not be sending those codes. Your ICD-9, of course, must be in the right order, or the best billable order is what you want to have those in. The ICD-10 is just for practice. The system will not be using them at all. The only reason after October 1st that you might be trying to match exactly an ICD-10 to an ICD-9 would be if you needed if you had 2 different insurances that had 2 different code sets required. So in that case, you would need to make sure these are exactly in the same order and the same code type, code description. If, for example, your Aetna was ready for ICD-10, but the Cigna was not. Now, of course, Cigna is a big one. They are ready already. But if that was the case, or you had a smaller paper claim insurance as their secondary, you would, in that case, need to double bill. So what will happen is you'll make sure these match for both code sets. When you save this claim, it will bill out if my date of service was after October 1st. The Aetna would get the ICD-10s, and the other smaller insurance who wasn't ready would get the ICD-9s at that point. So the computer is smart enough to know exactly what code set should be received. In fact, if you try to do ICD-10s today, if I did that right now, you will, without an ICD-9, you will receive a message when I try to save that your Aetna is not ready for that. So you'll get this pop-up. My date of service is 8/6. Aetna is not ready for ICD-10. It still will let you save the claim, but it will not bill it out. It will be coming on your charges not yet billed, waiting for the proper code set. So you will get prompted. This will be more important to you on October 3rd and 4th when you're new to using ICD-10. It will prompt you to please use the right code set. So that's a good feature for you. Does anyone have any questions on this charge screen or practice manager? If you are going to leave the call, you can type in a chat question. But as of right now, I think we are finished here with practice manager, and we'll go on to ChartMaker Clinical. But I have the chat open in case you write me a question. Okay, so let's go to ChartMaker Clinical. You have two options for adding new codes to your charts, and you do want to meet with some providers, meet with your providers and decide what makes the most sense for your office. You could create a brand new type of short note, almost like your chart prep note when you first went from paper charts to electronic, and it allows your staff to add some codes in a chart without a patient visit. So I have some offices who've let me know that they're looking at their October appointments, and they're going in and entering in the EMR or in Practice Manager their chronic codes. So the diabetic codes, varicose vein type of codes, anything chronic that they use on the chart all the time. They can add those in just to start getting those charts prepped. Your other option is just to simply add some new codes to your regular office visit note or meaningful use note and use that as you're seeing patients at the time. So someone did ask just a quick question on the practice manager side. For each insurance, once they're ready, what has to be done? At the moment, they will all be turned to ICD-10 as of October 1st. And they will only not be ICD-10 if you yourself go in that administration area to put in an insurance and what their new date is. So if you do not do that, every single insurance will be marking, will be sending out the ICD-10. And you would then go back to handle any dates that were not true for that patient. Oh, excuse me.
Hello?
I'm going to mute everybody again. Okay. So let's click the memo icon on this diagnosis checklist, and I'll show you how the crosswalk works in here as well. So I'm going to drag it over and make this a little bigger. So if you're going to look for new codes now, what you would be doing is clicking the Search Add Diagnosis and clicking the Crosswalk tab. So this is what allows you to see what we have, what you have already in the ICD-9, and then you can type in that code. So if you're looking for an acute conjunctivitis code, 372, you can see that code here, and you would type that right here. And it'll take you to where that is. So now this type of code, you may not want to put on an electronic chart in the summer because you're not going to use that probably again for this patient because it's just an acute code that hopefully will be going away in a week or two. So, but this does let you look at that crosswalk. What you might be focusing on are some of your diabetic codes and whatnot. So you can pull these codes if you'd like to put them on the chart. Hit the OK. And it gives you the same add to problem list. If you are a meaningful use user, then the SNOMED codes, you may need to pop those in for ICD-10 if it's not already selected. Not every diagnosis needs that SNOMED, but it will depend on your clinical quality measures and other items that you're reporting on. So that's something you may need to check out. You also have your comments at the bottom, and you simply hit OK. So that will put the new code here. But many offices are kind of waiting on the coding for the EMR. In Practice Manager, it's nice and easy to get to the crosswalk, and it doesn't hurt billing at all, and it just keeps it in there. But the code set is separate, where here in the EMR, it's going to put them all together. It's just in reverse date order based on date of visit and the last time you noted a code. So it may be something you delay a little bit longer to be in the EMR. What you might be focusing on in the EMR is creating your template so that you can have those codes ready for you. After October, there is a nice, easy way to take an ICD-9 and turn it into ICD-10, so to speak. So, for example, this routine child health exam, if it was after October and now I don't ever need this V20.2 again, what I'm going to do is click on it to note the diagnosis, and there's a little quick crosswalk tab at the bottom here. So what this is going to do, it really replaces the code. So please only use this crosswalk if you're ready to never use the V20.2 again. So I would say this crosswalk is for after October to use. When I click it, it takes me directly to the crosswalk nicely. I look at these exclusions here, but it will take me to this routine health exam. There are two, so you need to know the chart in order to choose this. So because one routine health exam is with abnormal findings and one is without. So the person who's selecting this code does need to be aware of the chart. I can hit OK. I can add my comments if I need to, and then I can hit OK at the bottom. It removes that old V code and replaces it with the new one, which after October will be fine. That will be a nice quick way to replace your codes. You'll simply hit OK. Now the old code, it gets stripped off your front screen here, but it is always available to you in the history. So I'm going to remove the note here, and we'll go to History tab. The History tab, it has a little diagnosis button at the top, but if you notice here, there's a little comment that it puts in automatically for you. It says converted or conversion of this ICD-9 V20.2, and it gives you the Z00.129. So it lets you know the tracking of this chart code, which now is gone for the ICD-9. So it's a really nice workflow for you once October hits. But if you're using that now, you're going to lose your ICD-9. So I'm going to suggest don't use that little convenient crosswalk tab in the EMR until after October. One quick thing to show you, if you're ever back here in the History tab and you want to see more things on this note, you can double-click it right from here. It takes you to the original note that came from, which is nice and easy. So we're back here in the diagnosis. I'm going to go back there for a moment. Let's click on that memo little tab, and we'll talk about this. The other thing that you might want to do right now as you're cleaning up some charts is to remove some of these codes that are no longer true for the patient. So for example, an acute conjunctivitis, if that's from 2 years ago, we should take it off of your face sheet because it's no longer a problem. Even a tension type headache, if that's more than 2 months old, I'm hoping the patient doesn't have that every time they see you, and maybe in this patient's case they do. But you can remove those codes by simply hitting the end diagnosis. It allows you to make a comment if you were going to want to make a note. But if it's simply an old code, there's no reason for a comment. You do have a little reason drop down at the top with some preset items that you can add yourself if you needed to. But that's not necessary as well. You simply can remove it. You do want to take the time, particularly if you open a patient chart and there are more than 15 diagnoses here that you're not currently using, this is a great time to start cleaning them up. Just remove them off the chart when they're no longer valid. So, and maybe you're only seeing that patient once a year, so you weren't in there to remove them, but this might be a good time to look at patients coming in October or November and start cleaning up their charts. It makes it easier for you to use your codes in the future. Okay, so I'm going to hit the OK. The view on the left side here, it is a little trickier once you start adding those ICD-10 because, like I said, it's not splitting the 9 and 10. It's simply writing in reverse date of visit order, which is usually fine, but in this little transition we're having, it might be a little confusing. You can tell that code set by clicking the little star. That will tell you whether it's ICD-10 or ICD-9. It also gives you comments if you did write some comments in here. So clicking that little star is what can give you more information if you need it. The other place, though, in the EMR you can see the code set separated is if you're attaching diagnoses to your office visit code and other procedure codes. So I'll show you that here by clicking on one of these office visit codes. In the center is where you can attach your diagnoses. Now, at the moment, you might not be using that part of the coding. You wouldn't have needed it if you still keep charge slips for your patients. So your provider may not be selecting which diagnosis goes with each procedure. But if you're considering phasing out your charge slip, this would be the time to start practicing this part of it. In the center, you click the little drop down and you attach what codes go with this office visit. And in this place is where it will separate it just like the practice manager side did, that you can tell exactly which code set you're using if you're not familiar with the codes. Now, certainly the new ICD-10 codes look extremely different. So you'll also be able to recognize it by that. But it is kind of nice to have it into columns like this. So if you're considering removing your charge slip or phasing that out, this will be required on each office visit code and other procedure, any CPT code. You would have to attach what diagnoses belong with it because you're going to send the charge to practice manager. So I'll show you how that works. You attach your codes here, and you are aware that this little checkbox is already selected. It's a Q charge. That means whatever procedure code you have here is set as billable. Sometimes you're opening a vaccine that you're just marking as already done or a history. In that case, you're not going to be billing it, so you would unqueue in that situation. And you might be hitting not performed and then say that the patient was already vaccinated. So usually it's one or the other. You're queuing that charge and you're going to bill it, or you're simply writing it as a history, and now that's a historical piece. If you do have a vaccine that you're giving, in that case, you would open that up, make sure it's queued, and also at the top, make sure you attach a diagnosis. At least one is required. And then you hit OK. When you've finished all the procedure codes, then you can send them to the practice manager side by clicking Note at the top, Charge Items. So that allows you, and it even tells you there's some non-billable items because we had that pneumonia that's not being sent. This will show your office visit, your vaccine, any other CPT code that you selected. At this point, if the provider realized something was missing, they could be attaching something else. Same for here. You can also be putting things in a different order. And then they simply hit Send Charge. What happens is, and that can be done before the note is finished. It can be done even if you find something later, we'll come back and add one more. You can send more than one time now from a note. But you must send before you sign it. So the sending of your codes happens before you sign it. So in Practice Manager side, you're coming here, and your biller has the option to check out the Pending Charges subtab. That allows you, if you're on a patient, it will show you just that patient. But if you're not on a patient, it shows you as many codes as are ready. And this screen has been updated in this last version. You can do more than one date of service, not more than one date of service, but you can do one patient, more than one charge at once. So if I highlight one date of service and choose this select all related charges, it lets me pull all three of those at once. And then the biller still has a chance to add or change things. But what you'll be doing is you'll be double clicking. It pulls in everything the provider sent for you, the office visit code, the diagnoses, and then the biller still has the option to fix what needs to go first, add in a referring physician, add in a modifier or approval pre-cert numbers, whatever else they need to do. The biller still has the screen to fix or change anything, and then they can save that. So it's not billing from what the provider wrote, but it certainly saves time. And for anyone who has had a note of the provider, then the provider circles something maybe that's not exactly what was in the note. You give it to the biller, and if the biller doesn't type it exactly right, you could have a charge that doesn't match your office visit note, which you would not want. So this does help save possible errors or misentries. So if you're not sure if this note has the charges sent yet or not, you can come back up to Note, click Charge Items, and at the bottom it will tell you which CPT codes were sent. So sometimes you are checking, oh, I don't even remember if I sent or not. This is where you can check that. It does not print it on the note, so in case you're printing this for another provider or a patient, it's not noted anywhere on the note itself. But you could be then selecting another CPT code that you forgot to send, pop in a diagnosis that goes with it, hit Note at the top, Charge Items. And that would allow you to send yet another code if you had forgotten one. So that's just the process of sending charges from the EMR to clinical. So the last thing I have to show you is in Template Editor. So we'll review quickly how to build your ICD-10 checklist. We do have a formal editing video. It's 20-some-odd minutes long. That has detailed instructions for adding either ICD-9 or 10 codes to your clinical notes. I would highly recommend watching that whole video if you have never used Template Editor, because what I'll be doing today is just a quick overview. Or if anyone was missing the webinar today or couldn't sit for one during this time, you can always watch that video at your leisure. Okay, so what we'll do, my suggestion would be, is you're going to open up the existing progress note that you use right now. You're going to create a backup of it, and then you're going to clone it or create another backup to make a smaller type of note so that you can just have some diagnoses on a note and work on your ICD-10 list. So I'll walk you through how to do this. So first, in the template editor, you would double-click on your main progress note, and you would make a backup copy. Highly recommend doing this, even once a month as you're making changes to your note, just in case something happens to your original note. STI has no way to back up your templates, and we don't have access to your templates, so it's something that if for some reason something happened to your provider's note, the only thing we can give back to you is your main specialty note, which I'm sure you've changed to be customized for your own self. So certainly the first thing you want to do is click Template at the top and choose Clone. This immediately makes a backup copy. It's called Clone of, and then whatever your note was. So if you want to put the date here, that makes sense if you do it every couple weeks or so while you're working on these ICD-10. If you try to save it and you already have one of that name, it does let you know there's already one of that name. So for me, I might just put a little 2 at the end of that and hit Save. So now I've saved a backup, and I can close that. The next step would be, let's open that progress note again, and we're going to change it. So first, I'll clone it again. So I'm going to hit Clone. But now I'm going to name it something like a chart prep note. So maybe ICD-10 chart update, something like that. And then my purpose is only to have the diagnoses here. So I'm going to highlight everything else on my note and delete it. If I could hit my delete, that would be. And then anything underneath, delete that as well. If you think you might use this on a real patient chart, give yourself a little statement at the top that shows it's not a visit. And then you could use this note on a chart if you'd like to. Not necessary to do that, but if you want to. And then I'm going to hit the save again. Now I have a new type of note with a totally different name. My progress note that my provider uses is already safe and back in its own little place. But this is now my ICD-10 working template. For my diagnosis checklist, I can hit on this little properties wheel, and I can change the heading if you want to let yourself know this is your ICD-10 working list, and then hit OK. Alrighty. So then I'm going to open the little memo icon so I could pull that open. So usually your purpose here is you want to take all the ICD-9s that you already have on your note list, and maybe you have to clean those up if you know your doctor doesn't use some of them. This is a good time to take those off as well. But you want to give yourself all the ICD-10s in this template that you'll be using. So the way to do it is we're going to hit Search, Add Diagnosis, hit the crosswalk, and then I'll be typing in the code that I see here. And I'll just go, I only have 3. You probably have lots more. But you'll type in that code, and it takes you to the crosswalk. So then I can close that a little bit to have a little more space. And then now that I'm in Template Editor, I do have 2 options. I can select the exact code. So in this case, there's really only one code, exposure to lead. And I would double-click that. But because in Template Editor, I have the ability to add categories as well. I can add both real billable codes, and I can add categories that my provider can see the category and simply open it up to get all the billable codes underneath. So depending on your situation with your type of patients, if you ever see patients with these 3 other items, you might want to also add the category. That way your provider has, maybe the arsenic you rarely ever see, but you want it in the template. But you don't actually need the code in there. You could add the category instead. And then you would go on, and let's get the next one. So the 82 is your tobacco use. So here, again, I have some history codes. I can double-click this one because I do use this all the time. But I wonder if I also use this quite a lot. If you only want 2, then I would just double-click those 2, and that would be it. But if you think you might use 2 or 3, what you could do is add that category. So in this place, you may want your provider to be aware of the options here. You can put both category and itemized code and then show them how that looks and see what they like better. It's really a personal feeling. So some doctors like to have exactly all the codes they will ever use in a big list. Some providers don't want such a big list. They would like some categories available, and then they can open a category for what they want. So it completely depends how comfortable they are on the computer and how much clicking they would prefer to do over having everything right in front of them. So there's not one best answer here. And then you'll start again, and I'll move that over a little so I can see this V13.00. And we would pull this other personal history. So if I want just that one, I'll pop it in. If I notice some more that are categories that would make sense for my specialty, I can double-click a category. I can even go up one more level. I would suggest from playing with this with another provider, you wouldn't want to go more than 2 categories up. The reason for that is you'll just have more clicking. If I add this category, the provider sees this level, and then they can click the plus, and they might just click one more plus. And so 2 clicks to get something you want, that's doable. But 5 clicks, if you went up too many categories, then that's just taking too long, and that will be frustrating for your provider. So if you are going to use categories, don't go up more than 2 levels. So just as a suggestion, certainly that might be different for your own provider. And then we'll hit OK. The system will take all the ICD-10s and group them together on top of the ICD-9. And at some point, you'll be removing your ICD-9. But this allows you to build your template so that you have as many ICD-10s as you'd like to show here. The template editor is alphabetizing these until you hit the OK. If you come back, it will alphabetize the next list you're adding starting underneath this one. So if you would prefer all of it alphabetized, I would say you'll sit here and add as many as you can to the category that you have selected. So that's the other thing we should talk about here. If you notice, of course, I have several different tabs at the top. You may only have one tab called Unspecified. What happened when we changed the template editor for ICD-10 last year, we converted all your templates, and we have this new option of tabs at the top. And to utilize them, it's called the group maintenance at the bottom here. You can change your Unspecified tab and rename it, but you also have the option to give yourself some more tabs. They don't have to be like this. Some offices like to have a diabetic tab, maybe a new patient tab, other types of initial problem types of tab. You can make any category that you want. You may be just following whatever your charge slip has. Many people's charge slips are separated per system so that you could put the systems at the top. So to use those tabs, click on your group maintenance. To add a brand new tab, you simply hit Add, and then you'd highlight New Group, and you could type over that. If you'd like that to be in a different order, then you'll move up and put it wherever you like that makes the most sense. You can highlight on any tab and rename it. You can delete tabs if you had added some you didn't want. And then you simply hit OK to save that. The video goes through that nice and detailed for you. Once you decide how you would like to organize these ICD-10s, it's possible what you'll have are all your ICD-9s on that first tab. It's probably not necessary to move the ICD-9s anywhere. You can, if you needed to, you can right-click on any diagnosis and move it to a different group if you want to, or even copy it to a different group. But it's not a bad idea to make your groups first and then add in your ICD-10s, so that you have these as your options. You can drag around this screen, so if you want something in a different order, you simply click on it and drag it somewhere else. So at the beginning, it will alphabetize, but this is just moving them as is necessary for you, however you like. And then you'll hit OK at the bottom. When you're in Template Editor, you do want to save every so often. So if you're handling one tab, do all the diagnoses that you want. It'll alphabetize them, hit the OK, and then come and save it. The reason I say that is because many offices are either working on laptops or wireless, and if your internet drops, even for 30 seconds, you may lose your connection, and the template editor doesn't have an automatic save. It has this little save icon, or the close will save as well. But it's possible you might lose work if you left this open for 45 minutes and it is not keeping the connection for you. So just in case you want to come out of there and hit your save. Okay. So let's handle how you would copy this once you're finished. So if you highlight this, excuse me, highlight your checklist, click Edit at the top, and copy. So you would only do this when you're finished writing all your ICD-10s that you think you'll be using. Certainly, you can always come back and change that as well. But highlight that, and then close this ICD-10 chart update. And then you would go into one of your real templates. It is quick at the top if you change all templates to be all instant templates. That will let you see any of those notes that are attached to someone's note list. So then I would be, when I'm finished, I would be moving to a real note that my provider's using. I would put my mouse underneath this diagnosis, and I'd be, if it's in the center there, hit your Enter key so that you can have it go to the left as you would want it. And then you'll click Edit again and choose Paste. Now, if you're doing this now, you may want to leave the existing diagnosis checklist on there. That's totally fine. The system will not print both of them. It will only print on the note whichever one you used. What does print, if you are printing your notes, are these little meatballs here. These are spacing holders. So if you don't want those to leave a big space there, then you want to delete them. Those little space holders truly print a space. All of this space here, this does not print. This is just a visual separation for you, but it doesn't print on the note. So if you did want to put a print space there, if you hold your Shift key down and click Enter, that creates one of those little space holders. Okay. So this note has an automatic save. When you hit the close, it's automatically saving. Sometimes you deleted something you didn't want to delete, and then you don't want to save it because you made a mistake. If you want to delete that first diagnosis checklist, but you deleted maybe the vitals by accident. If that happens, you want to uncheck the autosave and then hit close. It will prompt you, do you really want to save it or not? And in that case, I would say, no, I want to go back to the original and start from scratch. So that lets you get out of it. If you leave that automatic checked, which it already puts it in there for you, it will save anything you did, and there's no turning back. So if you had to, you could go back to your backup of some kind of note. So the next thing you could do with that little note is you could open it on a patient chart if you'd like to. So here in your, if you go into a patient chart, to add it as a real note to use, you'll simply click Note on the right, New Note, and when you're opening your new notes, the last option says Edit New Note List. So that lets you see what is available to you. It will show every single note, so you'll just go find that chart prep that you, that chart update that we just created. And you'll add that to your own note list. This is also a time you could delete some notes that you never use. You could take them out and then hit OK. Now you'd be able to use it on a patient. So if you wanted to go into some of those October appointments, you could come to your new note, open up that ICD-10 note, and it has a statement that says not a visit. Totally up to you if you want to do that. Many offices are not doing the EMR, adding these charts, but it might be a good time even to clean up. So I want my staff to come in here and get rid of all the old codes that are no longer valid, and then maybe put on some diabetic and other type of history codes that I like to have on my chart all the time. You could put those ICD-10 in there now. There is a new feature just before I finish here. If you haven't noticed this, it's something they created because of offices requesting it, that offices like to have the option to attach more than one code at once. If you don't write comments in your code, this is a nice quick way to add in a bunch of codes. And you can, it still allows you to take off some things that you're not really using for today and then accept that. That pops them all in as an encounter for today, which is nice and quick for you. If you do want to note on one of them, you still can hit your little edit the note and write some kind of comment. Okay, I'm going to get out of that. That is wraps up what I have to discuss for today. If you have staff that could not sit for a live webinar or you missed one, we have videos on our website or on our YouTube website that we have lots of videos, lots of the EMR videos here on our YouTube website.